Welcome back to the Move Better channel. This is John Peña-Serrata. We got Dr. Joe in the house. And today we will be talking about 4 signs that you need to fix that squat. Everybody's doing squats nowadays, and we should be doing that. But sometimes, do we do them right, or is it going to cost us a future risk of injury or dysfunction? So we're going to do that today, and hopefully you don't have any dysfunction. So let's go check this out.
So the 4 common dysfunctions that we see, right, and a lot of the time a patient will come in and they'll say, I need to fix my squat, or I need to work on my squat. And a lot of the time, over the years, we've been conditioned to worry about how the knee and the feet are carrying, right? And so the ankle and the foot complex, when we lose mobility in the ankle and the foot, there's compensations all the way up the chain. And so let's have you turn to the side and let's show them a dysfunction that we commonly see, right? Where they don't have the ankle mobility, their heels come off the ground, and they just put excessive pressure along the knee. That's where that problem came in. That's where most people, most trainers and in most classes come into play, and they'll go, oh, make sure your knees are behind your toes. So put your knees behind your toes. And immediately when that happens, the compensations that happen are his shoulders go way far forward, and the pressure goes on his lower back and his core, and that's where patients will start to suffer from lower back pain, hip pain, and that's one of the things that we want to limit when we want to teach these new patterns. In ankle dysfunction, we need to check, we need to assess, and this is going to be for another video, we need to assess your ankle mobility. How can your knees, how much does your knees go in front of your toes? We want to see, can you actually pick up your foot? Can you internally or externally rotate your foot? Can you supinate or pronate? And I know those are scientific words for you, but we want to see the control of your foot. If you notice that you go up on your toes and your heels come off the ground, simply put, in order to fix it, we need to work on ankle mobility. And that's something that we're going to be checking out on another video.
So another assessment when we're doing the squat movement is now you got to check the knee pattern when he does the squat. So as Dr. Joe does his knee pattern here, squat here, see how his knees are coming inward and they're a little bit shaky. Okay, when that happens, that could be a potential dysfunction in his knee pattern right there. Excuse me, squat pattern. And you may want to address that based off of its potential risk for injury. And usually if his knees are coming inward or knocking inward, there's a connective tissue or a dysfunction in the hip area, all right? And what we normally would do is identify that on which hip. It could be both, it could be only one, and apply connective tissue work, soft tissue work, such as foam rolling, and also some mobility exercises to get the hip complex moving a little better, okay? Because you gotta remember, the connective tissues that are wrapping around the knee goes all the way up to the hip. And if that hip is really tight or there's some kind of dysfunction going on, it's gonna affect the knee area. So we will normally, again, foam roll it or also mobilize that hip area.
All right, so another point that we often see is a hip shift. Now go ahead and squat down. Now when we see a competency, when we see a hip shifting from side to side, now we're looking at, hey, how does the pelvic floor, how does the lumbopelvic floor complex work with this dysfunction? Go ahead and stand on up. And when I say lumbopelvic hip complex, it's everything in this area that might be struggling to maintain control. Now, could it still be an ankle issue? It still could be, because you're changing your pattern because of an ankle dysfunction, so you're starting to shift over, you're starting to rotate. So one of the ways that we can actually tell if it's going to be a lumbopelvic hip complex problem or an ankle problem is by having him, change his patterns by lifting his heels up off of the ground. And when we do that, when we lift his heels, and then all of a sudden, let's say he does his squat again, hands up into the air. Let's say he does his squat again. Go ahead and squat and do it perfectly this time. And his squat looks perfect. Now, in this position, we know that his ankle is the dysfunctional joint that we need to fix in order to get his squat straight and to protect his lower back and his spine. So once again, if I have him do a squat with his ankles fixed in a position where it's slightly elevated, and then all of a sudden, go ahead and place your hands above your head, squat down, and his squat looks perfect, and there's no shifting from side to side, then I know it's going to be an ankle foot complex problem rather than a lumbopelvic hip complex problem. Go ahead and stand on up. Now, if I take these things away, or if I'm sorry, go ahead and stand on top of it again. Now, if he squats with his heels up and we still see a shift from side to side, then we know it's going to be a lumbopelvic hip complex problem, and then we can scrap the ankle mobility in this way. Okay, come on up. And so now I need to know that his core, his lower back, and his hips need most of the work in order to retrain that.
All right, so number 4, going into this point of view, the last section of the body that you will want to assess when he's doing a squat is the upper body, thoracic and shoulder area, and see what that pattern looks like. So as Dr. Joe goes down on a squat, if we see that the arm, the shoulder is falling too far forward, where his arm is not even aligned to the torso anymore, or the thoracic region, we're understanding that there's something going on with the shoulder, upper body movement pattern, okay? We have to address that. And it could be that he might be hinging too far forward, okay, or that his shoulder has a lack of mobility and flexibility, okay? Because what we want to do is when he squats down, you want the upper body from hip all the way to the back of the head, and the shoulder and arm aligned in one line, and it should be somewhat parallel to his lower leg. But if Dr. Joe's arm is going forward like so, we know that there might be some issues in the shoulder area and thoracic area, or even too much activation in the hip area with the hip flexor area region, okay? So if that's the case, then we understand that we need to make some kind of changes, and some corrective exercises needs to be applied.
So in order for us to assess our squat motions and to find out what's dysfunctional, we have to know what we're looking for as perfect, right? Or as good enough for the squatting individual. So one of the things that I want to look at when he's in his side view is place that hand straight up into the air. We want to see the angles of his hips, how his hips move along with his knees, and we want to make sure that the global motion of his body from his foot, knees, hips, and shoulders are all, and how they're all moving together as a unit and not compensating, right? So as you squat down, I want to check to see if his head is over his pelvis and he has a straight line in that way. The second, I want to look at how his hands are in alignment with his torso and his hips as well. And are the alignments from his hands, his ears, and this straight line in alignment with his ankle and his knee? So they should look like two direct lines working with each other in this squatting pattern. Come on up. And John has a pretty good squat right there, and we see that from the lateral view. When we look at it from the front view, go ahead and let's do the squat again. We want to check to see how his shoulders are in alignment, his hips are in alignment. We want to kind of just draw straight lines from the stick to the shoulders to the hips and his feet. So the two, what we call the ASIS, the two hip bones want to be in alignment there. We want to make sure that his shoulders are in alignment. We want to make sure that his hands are in alignment, and we want to make sure that his knees are in alignment so we don't see any intersecting lines, or we don't see any changes within those straight lines across all of those areas. Go ahead and squat down. Now, as we see, we want to make sure that the knees stay straight, his hips stay straight. We don't want to see any tilting at any point, his shoulders and his hands. Now, recapping the things that we looked at, when we assess a squat, we look at global motion first before we look at singular joints or local joints in order for us to fix. These assessments that we just checked today are just a very quick overview of how a person is adapting to the environment that they've been given. So a squat is going to be restrictive based off of the way they're living their life. Now we want to fix those squats just by counterbalancing the issues that we see.
All right, so as you do your squat assessment for yourself, don't forget you could always refer to a professional, a trainer, a physical therapist, a chiropractor to actually help and see what's going on with your squat. If you have any other questions or there's anything else that you need or want us to cover, please subscribe, notify us, or comment below in our video. Again, we are the Move Better channel, Dr. Joe, John Pina Serrata, and we'll see you next time.